the panelists. So I'll start off with the first one. I think this is for you, Dr. Iyabo. It says here, another reason for hesitancy has been the fact that some people have been convinced that traditional plans will do the job. There's been a flurry of such claims, the most prominent being by President Andrea Rajoelina regarding artemiside plants. My question is concerning the use of traditional African plants. Is there any effort to gauge this efficacy? Dr. Iyabo and Dr. Panagis, please, to respond.
Every pandemic or every disease outbreak, there's always some famed African herb that could cure it, right? There's that famed cure African herb. Having said that, we know that some herbs reduce fever, right? So if you have a fever, it will help. Like quinine was from the back of a tree, the original quinine. The dongoyaro plant, what you get from it, if you boil it, it's quinine. But there are no cure for COVID. There were no cure for HIV/AIDS. There were no cure for there were no cure for Ebola. So there is no cure that is the cure. And I knew there was all kinds of misinformation on that. But the biggest alternative that people are using is ivermectin. I'm a veterinarian, and I've used ivermectin for decades to inject. So my degree is in veterinary medicine and my PhD is as an epidemiologist. Ivermectin is only approved for one indication in humans, and that is river blindness. But people have created their own dosage. I've spoken to people that have used ivermectin to treat their own COVID. I've spoken to people that have used ivermectin as a prevention for COVID. Ivermectin, there is no data as I speak to you that ivermectin cures COVID. Will it relieve some symptoms? Possible, but it's not a cure. And even in the US, there was no ivermectin in veterinary hospitals anymore because people were buying it. They were buying it from everywhere they could find it. You can't even tell. When I've spoken to people that have taken it and believed in it, I've used what Dr. Panagis said. I have not said it doesn't work, because that just gets them infuriated and say, how do you mean it doesn't work, right? I've asked about what dosage you use. I've said, look, it's easy to use an overdose. Are you sure that, and they will tell you the science behind it. So will herbs work? Herbs might cause some symptoms to be relieved, but they will not cure COVID. There's nothing out there that is a cure for COVID at this point, other than prevention, which is vaccination.
Thank you so much. Dr. Panagis, do you want to add on to that? I have one question for you from the audience, or should I go on to that for time? Okay, so the question is around research. So there's a depth of research on vaccine hesitancy, promising strategies on addressing hesitancy, and peer-reviewed journals. Can we speak to how we can increase data and research to help drive effective strategies to address hesitancy and increase vaccine uptake?
Yeah, so I think this is actually a bigger conversation piece, because we've never been tasked before to do just that. Like, not just with you think of vaccine hesitancy more as a surrogate to say, the world is just hesitant with science. We haven't done well as scientists, physicians, and academic entities to make sure that we're part of the fabric of a community. So while we can do research on hesitancy, we got to also make sure we have the opposite ready to go. How do we react to that? We have, let me put it this way. In the last 10 years, we did research on NIH level grants, right? Coming out of the NIH, where they said you have to do community engagement. All right, 90% of community engagement was the research group putting up a website. That was it. That's not going to turn people, that's not going to earn their trust. We could do all the research we want, that's what we're good at. But at the end of the day, we need to put stock on medical messengers, on messengers that are going to be out there in the community in real time, talking about what health concerns people have and how a hospital, how can a healthcare system even begin to help? We have universal facts that themselves don't align with an overall belief, right? We have to make sure that we can be embedded into people's communities, to people's lives. So we can do all the research we want. That just really just helps us. But if we're not prepared to know how we effectively go out there, messaging it and so forth, we're going to just be spinning our wheels over and over again. So I hesitate to say, let's do research on it, because that's the cop-out answer. We will say, we need to invest in effective community engagement right now. And we have those tools. We have them ready to go. So from my standpoint, Kechi, I think we really, like, this pandemic shown a spotlight, and we are clearly not viewed as a public trust, and we have to regain that back.
Dr.
Yeah.
Kechi, if I can add to that.
Please do.
Somebody in the chat also mentioned it. For the African American community, and I think also for the global Black community, is a distrust of Western standards and Western medicine that has permeated. Some of it goes to the history of discrimination, the Tuskegee experiments and things. But also in Africa, it affected the polio vaccination and some of the issues that came from that. Is this idea that the West is not looking out for their best interest. And and there's no way you can target that unless you actually speak to that. And it is a very hard thing to speak to, but that is part of the hesitancy, and then it permeates. But there is an idea, which is always all the time, some traditional medicine alternative comes up and says, look, this is ours, right? So that has to be addressed. The general distrust of science has to be addressed, like it was mentioned, but that general distrust of science comes from a place and comes from experiences. Some of it is handed down information, right? What people have said happened in the past, and we cannot discount those anecdotal information and say, look, people should not care because something happened to somebody in the past. I know in communities, traditional communities in Africa, in which people will not go to the hospital. They'll go to a traditional person and there's nothing you can tell them to train them. They will tell you about somebody that died for a simple thing. So these are some of the issues on the ground.
Thank you so much, Dr. Iyabo. So in the last 4 minutes, I have 4 speakers, Dr. Anyatu and Dr. Godfrey from the first session. I really want to, first of all, say thank you for all the information that you have shared. I think one thing I would say from my experience is also, how do we tap into, you said it, Dr. Iyabo, you really hit the nail on the head. There's enough data, and we all know how people resist even the healthcare system, and people will rather go to the patent medicine dealers, the chemists as they call them in some countries, or even the traditional birth attendants, which sometimes are the mother-in-laws. How do we use also those traditional or cultural health professionals that are not really licensed? I think it's also something that we need to think about and look at. Well, in this last 4 or 3 minutes I want to turn it to each of you to 1 minute each for you to speak to this group we have here. What is one thing that you want to leave this group with? Just, what is that call that you would want to make, your clarion call, or, some kind of summary you want to share with the group? I'll start with you, Dr. Tesfaye.
Okay. So at the end of the day, we want to deliver a positive message towards our audience about the vaccine. Like, we're not trying to, brainwash people's mind. We're just trying to tell what is from our experience and what we have been seeing.